Hi, this is case of the day, and today is the 97th case. Next week I should be able to hit 100. But today I just went down two rabbit holes. um, and today's topic is completely different. This is not what I read or do on a daily basis, but I'll tell you how I came to this. So this is a left para-aortic nodal mass, and my question is, what primary malignancy does it point to, if it is malignant? So this 46-year-old had backache, had an MR done. MR showed this complex mass eroding the bone. It was also involving the left ureter. And so the patient had a PET done, which also showed a complex mass with solid and likely necrotic components. But only a plain scan was done. There was also this right-sided small lymph node, and the ureter was involved with proximal hydronephrosis. I came into the picture because the patient was sent for a CT-guided biopsy. And because I still was unsure about the extent of the solid cystic components, I did a contrast study which shows erosion of the bone, predominantly left-sided mass, partly kind of has an area of contact with the aorta. And I used an 18 gauge Cook 10 millimeter through only through the solid component, took multiple cores, and today, so that's what we would think of, right? Lymphoma, sarcoma, mets, very, very rarely in our country tuberculosis. So the idea being that during the biopsy, you take a little material for TB PCR and TB culture. The nodal mass was predominantly left sided, causing subtle bone erosion. And the reason for the case today is because a report came today as metastatic, poorly differentiated carcinoma from the genitourinary tract, likely cervix. And I said, you know, this is something that I learned way back during my residency, and that was, I think, partly because of this paper. And this was an era when single author papers were still known. I mean, today, except for perhaps a letter to the editor, you never have that happening. And Mary Stuart Fisher wrote this article. She was from, I think, Temple. Um, and her conclusion was that lumbar spine involvement from tumor spread is because of, this was all an X ray paper, is because of lymph nodal masses, and they all occur on the left side. So I went down a rabbit hole wanting to find more articles based on CTMR, etc., that showed that you get predominantly left sided lymph nodes from CA cervix, and there it was tough. Finally, I came across this paper from UT Southwestern, and it has this beautiful color diagram because I think this was from their data. And they showed how left para-aortic nodes account for almost 70-80% of the nodal mets in the retroperitoneum from CA cervix. And even when you get right sided, they are aortocaval, not really retroperitoneal. And so you have predominantly left sided, and that's based upon the pattern of lymphatic drainage, etc. So at least I found this because I was just trying to prove what I had learned, and I had somehow not come across anything since then. And if you look at the CT, you see that tiny retrocaval lymph node, and everything else is on the left side. And so now that the report said perhaps CA cervix, I went back to everything. Now the PET was a plain PET, shows very faint uptake. The MR shows distension here of the cervical canal. So now this would be, I guess, abnormal. And I remembered we did a contrast CT for me to characterize the nodes, and that's all I had looked at because that's what you would do. But right now, I just went ahead and looked at the images in the pelvis, and we can see this cervical mass and probably involving the lower uterine segment as well. And so it's all there. Which basically now the patient will undergo evaluation. It's still a very in the sense it'll get evaluated and everything will get proven, and then there'll be appropriate treatment. But it is unusual for carcinoma cervix to present as an unknown primary. At least that's what I think. And honestly, if anybody else has more information, knows more, has anything to add, just let me know in the comments, please. And, maybe I can add it on into the description later on. But I think if we ever see predominantly left sided para-aortic nodal masses involving the left ureter and bone, but not necessarily, they should raise a red flag for CA cervix specifically. And it's unlikely for endometrium to do that, though I've seen a couple of cases in the last 20-30 years which were from the endometrium. But otherwise, that should raise a red flag for CA cervix. That's the seminar we're doing in a month. My WhatsApp channel. Thank you so much for viewing this.